We are very pleased to welcome Andrea Malinowski of Rise Vermont. Andrea comes to us with a background. She is a local product, having lived here for since 1997-ish, thereabouts, and grew up not too far away, so she's a local product, and has run her own health club before she took the position with Rise Vermont. Has a background also in marathons and triathlons, and has participated in that. And she will share a little bit about what Rise Vermont does and the kind of lifestyle associated with that and promoted by that. So we are very fortunate to have Andrea here with us. It took us a few attempts to connect, but we are here and ready to go today. So, Andrea, the floor is yours.
Thank you, Mike, and thank you to all of you for having me today. I'm pleased to be here. I joined you in lunch a few months ago when Congressman Welch was here, and I kind of got bumped because apparently he's more important than I am. I don't know. So thanks for having me, and actually it was through Congressman Welch I was able to secure some tickets to tour the White House. I took 40 women to Washington, D.C. the beginning of this month for a half marathon, and you have to apply through your congressman's office to get approval. So we all got tickets to tour the White House, and you're such a patriotic group, I have to share with you. Also that day, my dad, who's a Korea War veteran, was on a Patriot honor flight. Coincidentally, the same exact day I was in Washington, D.C. So I was able to hook up with their group, and they let me. I had to literally run from the Capitol to the Lincoln Memorial, which is 2 miles, which when you're in a hurry and you think you're going to miss the bus seemed like 10 miles. So I ran to the memorial and I hopped on their bus, and I got to tour the rest of the memorials with all the veterans for the rest of the day, including Arlington National Cemetery and the changing of the guard. And it was just so amazing that I was there with my dad, you know, go figure, on the same day. So it was really meant to be. So it was great. Yeah. So Rise Vermont, if you haven't heard of it, is relatively new in Bennington County, and I'd like to share with you some of what we're doing and what we're all about, what I'm all about. Rise Vermont started, the idea of it, well, let me back up. The program itself started about 5 years ago in Franklin and Grand Isle counties. So it is a statewide health nonprofit initiative to help all Vermonters embrace healthy lifestyles. And the idea came from a European model, which was addressing childhood obesity. And there was a doctor at Northwestern Medical Center up north who took her entire team to the Netherlands to see this health model in place. So they got to see healthy lifestyles and healthy living, and they decided this was something that had to come back to the state of Vermont. So they implemented it in Franklin and Grand Isle counties in 2014, 2015. So now the goal is to be in every county by the end of 2019 into 2020. So pictured here are that says Magnet. We're missing the M in the picture. Southwestern Vermont Healthcare is my employer, and they've adopted the Rise Vermont program as part of their health initiative. And shown there is Tom D., the tall gentleman in the center with the suit on, who's the CEO of SVMC. And to his left is Billy Allard, who is my boss. She's the chief, she's in charge of transitional care nursing, which is where people follow up when people are discharged at home to make sure they're taking their medications properly, that any questions they might have, to help ensure that they're staying healthy and may not need a readmission in the hospital. So this was a national conference where the hospital here received the Magnet Nursing Excellence Award, and there is only one in the entire world per year that's awarded, and our hospital won it. So with that came a $50,000 cash prize, and they donated $10,000 of it to the Rise Vermont Startup Fund because they felt so strongly that we needed a preventative primary prevention model in our community to help people stay healthy. And they were partnered with the Vermont Department of Health, and there was the local director, Kathy Vogel, who is no longer in that position, but she and Billy Allard were very strong advocates for this program to be adopted by our hospital. They had seen it in action, and we need to help people stay healthy was what their driving force was. Rise Vermont falls under the One Care Vermont umbrella. I'm not sure if you're familiar with One Care Vermont. It's an accountable care organization. Boy, I can't see that screen from back here without my glasses. Basic working with Medicare, Medicaid, and self-funded insurance programs. The idea is that through a single payer system where the hospital receives one lump payment for a certain demographic, and they debuted it with monies received just for Medicaid patients. You get one sum of money based upon the past year's need, and then it's up to the health organization to manage those funds, and any surplus that's left over gets to stay within the healthcare system. So it's in everybody's best interest to keep people healthy, because not only are we creating a healthy landscape, we're saving money in the community by not paying for unnecessary medical treatment such as readmissions, when maybe we could go to the home and make sure that people are staying healthy and have the care that they need. One Care Vermont actually falls, the bigger umbrella above that would be the Green Mountain Care Board. So how all of this came to be was with the Affordable Care Act. The Green Mountain Care Board was formed to oversee healthcare systems and make sure that monies were being dispersed properly, that healthcare was as good as it could be, and that everybody was staying as healthy as possible. So the triad that you see there, the goal is to improve health, to lower costs, and to provide better care. I'm sorry that you can't see my slides when I stand here. So this is just a little flow chart of how the process works. So One Care Vermont, as I said, falls under the advisory board of the Green Mountain Care Board. And then there's a statewide team for Rise Vermont, and those are the statewide manager and the local program manager, Marissa and Emmy. And they, Southwestern Vermont Healthcare signed on to this process. So pictured there are Tom D., the CEO of the hospital, and underneath Tom is my boss, Billy Allard. And then below the hospital level would be the local program manager, which is myself, and I'm the manager for all of Bennington County, although in its beginning stages we've decided to focus on 2 towns first, which are Bennington and North Bennington, to implement programs and practices and see what works, what we need to tweak a little bit, and then to expand our service area first in the local supervisory union towns, and then to the outlying regions until we've met all of Bennington County. And underneath myself as program manager, we have a steering committee, which are local invested healthcare people, someone from the Department of Health, the town development director, to really advise. So we all sit and talk about what is in the best interest of our community and where are our services best served. And then the stakeholder group is anybody in the community who has a vested interest in health and wellness in our community. So those logos are just a small sampling of the people that we've worked with so far. Love to put a Bennington Rotary logo in there too. And it's really just forming partnerships and seeing who's interested in offering a healthy program, an initiative. How can we collaborate and work together as a community to ensure the health and wellness of our residents? So a little bit about myself. As Mike mentioned, I've been living in Bennington since 1997. My husband and I have 4 children, and I was a stay-at-home mom. And then when my daughter went off to kindergarten, I said, oh, okay, so now what do I do? So I wasn't really quite sure. And then my mom became of failing health, so we spent some time, devoted to her care. And she She died at 80, which I think is young in today's standards. I think we have the ability to last a lot longer and be healthy past 80. And she had what I consider preventable diseases such as diabetes and heart disease, and led a sedentary lifestyle, and one thing leads to another, and it all snowballs. And in some of her last days, she spent in a nursing home, and she said, "Promise me you'll never let this happen to you." And I said, "I promise, and I'm going to bring along as many people as I can on the journey to stay healthy and take care of yourself and practice self-care." And it's not just for ourselves, right? It's for our families as well, because I know as an adult child trying to take care of my small children and my mother, it was really a struggle to not only find the time, but there wasn't much I could do to help her, because at that point it was already, health situations were irreversible at that point. So I said, "I promise I'm going to start a revolution, and we're all going to be healthy." So a little bit about the duties as program manager is to identify stakeholders, so community partners, to organize community events. And so not only do I do grassroots events, but I also look to collaborate. If someone has something happening, how can I help you? What kind of value add? I can come do an exercise, or we can talk about healthy cooking, healthy options. So it's not just always my brainchild. If there's something happening, why reinvent the wheel? Let's do, a value add and help. Budget, I get an Amplify grant budget each year. So Amplify grants are little mini grants that we can award throughout the community. Last year we had $25,000 allocated to Bennington County. So basically between $1,000 and $1,500 per grant. If someone had an idea, they wanted to do a 6-week healthy workshop series about cooking, they would work with me to prepare a grant application. We would submit it, and whether we get approval or have to tweak the amount, and then help them to implement that program in the community. So I oversee the budget money. I'm a champion of health, as I said, so that's my first and foremost responsibility. And just a little bit about certifications. I'm a certified health coach and group fitness instructor. As Mike said, I formerly owned a fitness studio here in Bennington, and I wasn't even looking for a job. My business was thriving, and I had a great clientele. And the interim manager for Rise Vermont last summer contacted me to see how she could help me with my business. So much the same that I do with people now, say, how can I help you? She reached out to me and said, what can Rise Vermont do to help promote your business so we can keep people healthy? So I went into a meeting at the Department of Health with her, and one of my friends works there, and she saw me come in. She said, I'm so glad you're here to apply for the job. And I said, oh no, I'm not here to apply for a job. I'm here for a meeting. And it was the program manager job. So fast forward to today, I accepted the job, and it came at a pivotal time. I was maybe ready to not be a small business owner anymore. I'm sure many of you can appreciate that, right? The hours that you put in, and the bookkeeping, and the rent, and everything that was entailed. So now I have a full-time job with benefits, and I don't have to do the bookkeeping. And I'm like, okay, so that's not so bad. So it did turn out to be good timing to accept that position. The objective, as I said, of Rise Vermont is embracing healthy lifestyles to help everybody see what they can do in their day-to-day living to maybe make a little bit healthier choice for themselves, to support and inspire Vermonters to embrace healthy lifestyles. And the key is making the healthy choice the easy choice. So accessibility, cost, making sure people can get there. It's not prohibitive because it's expensive. And wherever you are, where you live, work, learn, and play. So I go into schools, I go into workplaces about worksite wellness programs. I work closely with United Counseling Service on their worksite wellness development and their committee. I serve on the hospital wellness committee. So anywhere, and into businesses, even if you're a small business owner, what can I do to maybe help you offer something to your staff that might be a healthy initiative to keep them inspired and healthy? Because we all know that healthy employees are happier, there's less sick time, they're more productive. So anything that I can do in the workplace as well. Oh, so the little snow picture there was fun. It was That was the Martha Canfield Library in Arlington. And in the winter, schools release early on certain days for the GISP program. And around in Bennington, if they go to GISP, they go, and the kids stay in school. Arlington dismisses all of their kids at noon, whether they ski or not, on GISP day. So then there's these kids that don't ski that might not have something to do. So I went and we did a snowshoe activity, and it took us about 45 minutes to get the snowshoes on. And we got outside, and no kidding, within 5 minutes, we're tired. I'm like, oh no, we're snowshoeing, because it took us 45 minutes to get here, and we're gonna have fun. And it started raining. I'm like, no, we're going, keep going. And they wound up having a good time. So that was just a silly picture. If you can't see it, they're all making goofy faces, myself included. So that was fun. So Rise Vermont in the community, we're really trying to get the word out and support, as I said, local events, come up with new ideas. The two kids on the left, that was National Take a Walk in a Park Day that we held at Willow Park. And as far as collaboration and partnerships, we brought on board the YMCA came with an activity, Bennington Aces, which is an after-school tennis and academic program. They came, Alliance for Community Transformations did a scavenger hunt, so not only did families come walk in the park, but then they did the whole loop because they were doing a scavenger hunt. And we had hula hooping and activity dice, and we had 125 people come. So it was just a really great turnout, and it really showed everybody that there is something fun and healthy you can do with your family. And we were inspired that so many people came out. And it was really with that collaborative effort of businesses all putting their logo on the flyer, and it really made it look like it was, you know, gonna be a big event, and it was, so it was fun. Walk and talk meetings, I like to have walking meetings with people. I just had one the other day to talk about nature retreats, and we decided to take a walk on the trail alongside the hospital. There's a nice 1 mile trail, so why sit in a stuffy office when you can go outside and lace up your sneakers and take a walking meeting. And the upper right corner is the famous smoothie bike. If you haven't seen that, it's a stationary bicycle that you pedal, and it spins the blender blades. And no, we don't make margaritas with it. I just want you to know. I get asked that all the time. But yogurt smoothies, you know, fruit and juice. And it's fun for the kids to really see their physical efforts pay off, and then they get to enjoy the smoothie. And Healthy Kids Day was a YMCA effort at the Bennington Rec Center. It's a nationwide program that they do. So they took the Willow Park Easter egg hunt, they brought it to the Y, and we did a pool noodle obstacle course. There was tennis demonstrations, you name it. It was a huge event. I think they had 400 or 500 children pass through. And of course, it's all about the Easter eggs, but it was fun to do the scavenger hunt, or the obstacle course with them. And yes, I did crawl through the obstacle course myself. So just some other activities in the community. National Take a Hike Day, which is in November. I'm not sure why that was put in November. That really should be a summer activity. But there was snow, and we still did it on the Ninja Path alongside Walmart. If you haven't been on the Ninja Path, there's a paved section from right behind Fuji Restaurant, and it goes all alongside Walmart. The bigger Ninja Path is longer than that, but it was nice for kids to be on bikes and have strollers on the paved portion. And I have a fun, healthy Jeopardy game that I bring to health fairs, along with my Sugar Smackdown. I have Gatorade, soda, energy drinks, and all their associated sugar content in a Ziploc bag. So people have to guess what has the most sugar. And I always have giveaways, but I don't just give away my giveaways. People have to come interact with me, play my games, roll the activity dice. Maybe kids are doing jumping jacks or sit-ups on the floor, push-ups, and then they get the fun Rise Vermont giveaway. So they have to work for their giveaway. And in the bottom right corner, SVMC Walk at Work. I've tried to start a Walk at Work initiative at any workplace, and the hospital jumped on board, and that was really a die-hard crew that comes out. That was the start of it. It was the middle of winter. It was dark. It was freezing. I just saw them yesterday. Their crew was still out there every day and they make time. And a lot of us shortchange ourselves on lunchtime or breaks that we're really due. And especially, I see that a lot at the hospital or places where people are caretakers, that I can't take lunch, and I don't have time to do that. But it is important to take time for your health. And they go out and take their 15-minute walk every day. Luckily, yesterday it was sunny and not the middle of winter. So just, the inspiration that it doesn't take long to take care of yourself and get out and do it. So as I mentioned, we have Amplify grants, which help, I call it like sprinkling pixie dust around the community to help get the energy started that we can do these great programs and that maybe they can sustain themselves even after the grant money expires. So there was one effort, Learn to Cook at Willowbrook. So Alliance for Community Transformations received a grant along with Head Start, right? Yeah. And they brought in a chef and they learned how to cook. It was a 4-week session, and they received maybe a crock pot giveaway, but they had giveaways to take home, cooking utensils, the knowledge. They ate every week what they prepared. Just great opportunity to get to certain populations that might be more in need than others that really need this education of how to be healthier. This past week, we had the local motion bike trailer, which is a trailer that comes chock full of bikes from up north. It's the first time it's ever been to the southwestern corner, so I was really excited about that. Mother Nature didn't really cooperate with the bikes last week, unfortunately, but they were there at the middle school all week, and kids used them for phys ed class. They learned about bike safety, health class came out. We did have a culminating event planned for Sunday, which unfortunately had to be canceled because the fields were not perking and it was bogged down with water. And so we hope to reschedule that, maybe with the bicycles as well, but it was nice to have the bike trailer. Another partner is the Bennington Library, where they received a grant to host walks on the Wildflower Trail at the museum, as well as What's Your Story walks that they'll be hosting this summer from the library. A walk and talk with the librarian about healthy things, come back, have a snack. So just a little sampling of where we like to invest our funds. These are my favorite pictures, that little boy in the upper right corner. Can you see him? Yeah. Mm-hmm. So mindfulness has been a real hot topic in the community, especially with children, learning self-regulation, coping, de-stressing skills, because it's a tough world out there, and our kids often pay the price. So with the focus of childhood obesity and child wellness, figuring that if we help educate our young people and bring them up in a healthier manner, that future generations will follow. Not that we're not important, but we really want to reach out so kids learn that there is a different way that they can make choices and be healthier. So mindfulness was a great way for them to learn about ways that they can cope with life and stress that might help them make healthier choices down the road versus, sometimes we turn to food because we're unhappy or we're depressed or we're happy or whatever the case may be. So learning how to deal with those emotions in a more constructive way. So there was a grant that started at Molly Stark Elementary with Deb Lewis in the larger picture, and she taught over 80 kindergartners these techniques over an 8-week session. They were very responsive, as you can see. The little boys in the corner were really digging it. It was fun. So after that, Pownell Elementary was interested in a grant, and we quickly realized if everybody got an Amplify grant for mindfulness for one classroom, we were going to be out of money. So we wanted to spread it more, so we did a community-wide teacher training. So we brought in yoga for classrooms. It was a 1-day training where over 50 area educators and professionals came to learn simple yoga techniques and mindfulness that they could bring back to their classrooms or their daycare center or their office. So in that respect, we reached hundreds and hundreds of children with these practices versus just one classroom, which was very satisfying. I won't read all of that to you, but those are all of the grants that were awarded. We're ending our fiscal year June 1st. So since last May, these are all of the grants that have been awarded in the community. Most recently, pickleball is really popular, so we're getting some nets for, I think it's Shaftesbury that's looking to install some courts. And there's just been a great sampling of healthy initiatives in the community. So where do we go next? As I said, we're in Bennington and North Bennington. I think we'll probably focus our efforts here for a while longer to really get some strategies in place. And we have a strong stakeholder group, as I said, interested area partners, businesses, which are working for us, but yet we have to start that all over again when we go to a new community. So we go as far as Rupert is Bennington County, so we're not going to use the Bennington stakeholders, obviously, in Rupert. So we really have to find out what works here and then restart the process in neighboring towns. We've focused a lot in the past year on just getting the word out about Rise Vermont, what we are, hosting a lot of events. So now I really want to get into the nitty-gritty of getting into classrooms and maybe helping change if there's school policy that doesn't support wellness as much as it could. So I'm on the SVSU Wellness Committee as well. So advocating for any policy change, because really to affect change in schools, it has to be a policy. So that's something that we'll be digging into, advocating for the community as well, perhaps at select board meetings for different things that come up. And workplace wellness. So if there's anybody interested in bringing something, a healthier initiative to your work site, let me know. And we have scorecards, a Rise Vermont scorecard, which I can come in and talk with anybody, be it a school, a workplace, to say, these are steps that we feel might make your environment healthier. Let's see where you're at. Maybe you're already meeting some of them. How can I help you if you aspire to create change to maybe make it more healthy? And once you reach the gold level, you get that swanky Rise certified sticker for your business. Doesn't everybody want that, right? In their window, on their door, to say, I'm a healthy place of work or of business, of school, whatever the case may be, that I support wellness, and that's a great thing. Wow, talked a lot longer than I thought. So that's my contact information. There's some cards on your table. The cards on the table say, is it in your county? Yes, it is in your county, but I thought I'd still put them out. So there's a generic Rise Vermont website so you can see what other counties are doing. There's a way you can contact me through there. There's a calendar of events locally and for all the other counties that have adopted Rise Vermont programs. So certainly look through the website, and I'd be happy to field any questions or comments.
Well, I think it's wonderful what you're doing with schools. I mean, I think that's very important.
Thank you.
But it occurred to me in terms of thinking about what Rotary could do, what programs do you have for people who are retired who still have to keep going?
Well, we actually, great question, we actually just afforded an amplified grant to the Green Mountain RiseVT program to help support their bone builders programs. So they needed some weights or additional things for those programs. So it isn't so much perhaps that I'm hosting events for older Vermonters, but I'm working in conjunction with the Council on Aging to support their efforts, to see if maybe we can expand programming and maybe offer more bone builders or silver sneakers classes at the senior center, Tai Chi. So I am looking, that is on my hit list of things, is to work more closely with the senior center to see how we can expand efforts. Thank you. Beth.
And I would also add that some of the things that you did as part of your business are now funded through Rise Vermont, like your aqua dance class, which a lot of retired folks, my mother-in-law and her best friend, love at the rec center, but that's not my question.
Thank you for mentioning that. Yes, I do offer 2 free classes at the rec center pool, Monday evenings and Friday mornings, which are great for all ages and abilities.
So SVMC has really invested in Rise here, that $10,000 taking you on as an employee. How does that work in the other counties in Vermont? Who's like the fiscal sponsor? Is there that same amount of buy-in?
Generally, the Rise Vermont program is adopted by a healthcare agency. So it is hospital supported. Yeah, so they really, the Rise Vermont statewide team works with a hospital, if they're not in that county, for them to buy into the program. Because it's the hospitals who subscribe to One Care Vermont as the accountable care organization. That's a voluntary buy-in. And so with that in mind, they're already associated with the accountable care organization, then they buy into the Rise Vermont program. Yeah, so it's always the healthcare system. Yeah. Thank you so much for having me. Thank you.